Hey, so I'm here at my doctor's appointment, and I guess I'll let you guys know how it goes when it's over. Everything should be fine. I mean, I'm not feeling any pain or anything. I did want to ask some questions about my iron level because I'm just not sure, if I'm having trouble with iron because I've been craving a lot of turkey lately, but we'll see. So I shall return in a few to let you guys know how everything went and give you pretty much my 22nd week update. As of today, I am 23 weeks and 2 days, but I'll come back with my 22 week update. Alright, see you soon. Okay, so I'm back from my appointment and everything went great. I'm proud to say. So this is going to be my 22 week update. So as far as my appointment today, it was just a basic prenatal appointment. We did my weight checked my urine for sugar and other things that they check the urine for. And then we came in and we discussed some of the things that she had scheduled for us to discuss from my last prenatal appointment, which was 4 weeks ago. And one of the things, I don't know if y'all remember from my very first video, I explained that my last child, because I have 3 children already, my 3rd child was a premature child, and the doctor wanted to know the cause of me having to have a cesarean, because I did have a cesarean. If you want to hear more about that, I'll put a link down below for the first video that I discussed that issue with. But so I had to go to the last hospital that I gave birth with my youngest child and have them, send them records as to my discharge summary, the result of, what happened after I gave birth, the reason, the cause, and, just things of that nature. So we discussed that, and come to find out, which I didn't know, that my daughter was breached at that time, which was interesting. I mean, I knew that my placenta had ruptured, and I had to have a cesarean as an emergency procedure, but I didn't know that they also notated that she was in a breech position, which was, good to know. So we pretty much discussed that, and after discussing, all the doctor's comments from the discharge summary, we did come to the final conclusion that I would be able to have a VBAC. So I'm excited about being able to try for vaginal birth. So we discussed that. We did review my anatomy scan that was on May the 18th. And she, discussed how everything looks normal. The heart looks normal, the brain, and everything as far as the anatomy scan went perfect. And I asked her, the position of my placenta. I was curious. I meant to ask the ultrasound technician, but that question hit me after I left. So I said I was going to remember to ask my doctor about it today. And I went in and I did ask her, and come to find out that my placenta is in the front, which I didn't know. And I found that strange because, I feel his movements. I feel when he kicks or punches or whatever he's doing in there, I feel those movements. So, when she told me that it was in the front, I'm like, wow. I just didn't know. Maybe that could be the reason why it took me so long to feel the actual movements. For a very long time, it felt like flutters. Like, I always read that, after your first child, when you get into the, later, more children, you feel the baby movement sooner. And I'm like, I'm 15, 16, 17 weeks. I'm not feeling any movement. I felt the little flutters, but, I felt as if I should have been feeling more movement. And now that I know that the placenta's in the front, that probably explains why I didn't feel movements until late. But I feel movements now. I feel him moving in there all the time. But you know, it's strange because my husband and I, we were laying in the bed the other night, and he had his hand on my stomach, and the baby was just kicking and bumping and moving, and he couldn't feel it. And I'm like, you can't feel that? I felt it. I'm like, you can't feel that? It's like, it's so obvious, but then it makes sense. You know, maybe to me, because I feel him moving in the inside, that, you know, I feel like I can feel it moving from the outside, but I guess you can't, because he couldn't feel it. And he was kicking his butt off, and he couldn't feel it. So that explains why. So maybe it may take a little longer for, you know, my husband to be able to feel the baby moving on the outside. The ice cream man will come down. Like, the ice cream man really will come down. So anyway, so yeah, I'm sorry, I went on a rant about that. So yeah, I found out that I have the anterior, I believe is the right medical term for it. I believe that's the right medical term. Well, the placenta is in the front, it's not in the back. And so we discussed that. Now, as far as things that I have been experiencing through my 22nd week, the biggest thing is the movement has been increasing. So I have been feeling movement. And for some reason, as far as things that I've experienced in my 22nd week, I've been craving a lot of turkey. And I forgot to ask, I'm going to have to make a note. I forgot to ask the doctor about my iron levels from prior tests. I know she did schedule me for some blood work and the glucose test for my next appointment, which is in 4 weeks. So I'm gonna have to make sure I'm making a note about that, to ask about my iron, because I've heard and read that when you crave a lot of turkey and things of that nature, turkey, and it was something else. I think it was ice, or it was something else. But I know turkey was one of the things on the list that your body needs more iron. Now, I do take vitamins daily, and what else? I think that's it. I did do a baby haul video, so if you haven't seen that video, I'll also put a link below for that. That I did start buying the baby's things, as far as, you know, I have the crib, Pampers, and just little odds and ends things, and clothes and things of that nature. I have a trash bag full of clothes. I just still haven't got around to washing those yet. I think I'm not really rushing to wash the clothes, because I really don't have his sleeping area set up yet, and I don't have his dresser set up. So, you know, I don't want to wash them, fold them, just to put them back in a bag. So I was thinking about maybe buying like a $5 storage bin just for now, just so I can get them washed and folded up and put them in there, just until I can get his room and his space set up as far as his dresser and things of that nature. As far as my 22nd week, you know, it's been pretty quiet. I haven't been having any headaches. I do still get the pains. Oh my goodness, I got pregnancy brain. Not breast and hicks. What is it called? Round ligament pains. Whew. I still get the round ligament pains, and baby, those pains ain't no joke. And I'm like, when I get those pains, especially when it's sharp, sometimes it's just like a cramp, and I'm just like, all right, just get a second, it'll go away. And I stretch out, sit tall, because I know I have a tendency of slouching. So sometimes I stretch up, I massage that area, I'll stand up, I walk around. So the cramping ones is fine. It's the sharp pain ones. Whoo! When you get that sharp pain, and it's like, oh my gosh, it stops me. I gotta hold on, I got to bear down. I'm like breathing through it. I'm like, is this practice? Is this, I'm sorry, I'm shaking the camera. I'm thinking, is this practice or what is going on? But those round ligament pains are no joke. They are no joke. So, I still experience those. And another symptom that I've noticed for my 22nd week is itching. I don't know what that is about. I've been trying to do some research on it, but and it seems to always happen when it's time for me to get ready to go to sleep at night. For some reason, at night, I'll get in my shower, I'll lotion up, get all fresh and clean, and then when I get into bed, next thing you know, I'm just itching. My legs is itching, my whole body just is itchy, and it's like, it makes me twitch and move, and I'm scratching. I don't know what that is, and it happened for, for a few minutes, maybe a half hour, and then, as I start getting tired to go to sleep, it'll go away. That's just started happening, and it happened on a few nights, a few times. So I'm not sure what that's about. And I was going, if anybody know anything about getting the itchies, that's the only thing I can think of, getting the itchies. Please can you leave a comment below and let me know what to do. I've been trying to do some research on it. So that's something else I've been noticing. Besides the craving for turkey, I really haven't had any other cravings. I haven't had any food aversions. And yeah, I think that's about it. So let's go ahead and do a belly shot. Let me try to make this work. I'm sitting on my bed. Try to turn this way to the... I would have a black shirt and my curtains are black, so I'm trying to get this as best I can. Alright, let's see. See if I could push this back. That's still not good. Alright, how about this? One moment. Okay. I think this is the best I can do for the space that I'm in right now. Okay, so, excuse that, look at this. This doesn't make no sense that I gained that much weight that my t-shirt won't even go all the way down. But, I had short sleeves and it was a little chilly, so I wanted to put this long black shirt under it so that I can at least stay warm without my arms and stuff is out. So, this is my side view. This is the front. You can see through this t-shirt. That's why I'm gonna put that down. Okay, this is the front. And this is my other side. These are my little night pants I just threw on to get comfortable. I just came from the doctor's appointment. So, here we go. It's the belly shot. And I can't believe they don't cover. So, yeah. So, as far as my 23-week update, I believe that that's about it. So, I will see, well, I won't see, but I will talk to you guys. I'm sorry, I'm not even looking at the camera. I'm looking at myself. But, as far as my 22-week update, I believe this is it. And I will talk to you guys next week to let you know how my 23rd week is going. So until next time, talk to you guys later. Peace.